Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips to identify, prevent, and treat a COPD exacerbation. Tip number 1 is recognizing a COPD exacerbation. COPD, or chronic obstructive pulmonary disease, is very common. The most common cause is from a long history of smoking. A COPD exacerbation is when you have an increase in your shortness of breath, or increase in your cough, or increase in the amount of sputum that's coming up when you cough, or in the character, or a change in the character of the sputum, like it's becoming yellow or green. If you have an increase in any one of those symptoms, then you have a COPD exacerbation. And if you have an increase in 2 of those symptoms, then your COPD exacerbation is moderate. Often, if you have an increase in 3 of those symptoms, then your COPD exacerbation is considered severe. COPD exacerbations are most commonly caused by infection, and the number 2 cause is air pollution. The causes of infection in COPD are Haemophilus influenza, Warxella catarrhalis, and strep pneumo, in that order. Tip number 2. Tip number 2 is how to prevent COPD to begin with, and therefore prevent COPD exacerbations. To stop smoking, and don't smoke don't start if you don't already. So I recommend, or recommendations are for 3 different types of treatments, and I'll give you them in the order of the most effective to the less effective, although all 3 are extremely effective and extremely helpful for people who smoke. Chantix, or varenicline, is the most effective medication to help you quit smoking. The problem is that in some people, it causes them to, in some people who already have depression, it can cause them to think about hurting themselves. So if you have a history of depression, it's more than likely that your doctor will want to avoid Chantix. Nicorette and Nicoderm, those are brand names. But we're talking about nicotine gum and the nicotine patch, and you use them both. The patch is on every day. Nicotine gum is as needed on top of the patch. In addition to the patch. This is the number 2 most effective way to quit smoking. And the number 3 most effective way is Zyban, or bupropion. This is a pill that's effective at helping people quit smoking, and it's also useful if you're worried about gaining weight after quitting smoking, because people who use Zyban are less likely to gain as much weight as people who use other forms of smoking cessation or no smoking cessation medication at all when they quit smoking. Tip number 3. If you have COPD, it's important to remain healthy, and one of the ways to do this is with walking. Walking is what I recommend for everyone for exercise. Especially in COPD, it helps you rebuild your lungs and prevent them from further damage. Walking is a great exercise. It's called an aerobic exercise because it makes you breathe harder, and that improves oxygen getting to your tissues. I recommend 30 minutes a day of walking, but you can start at 5 minutes a day and build up from there. This is not a way of treating an exacerbation, but a way of preventing worsening of COPD to begin with. Tip number 4, make sure you're on the right medications for COPD. So your doctor should send you for a lung function test, and you should know what your FEV1 is. That's how much air you breathe out in 1 second. The medications that you're prescribed, or that you should be prescribed, will depend on your FEV1. If your FEV1 is greater than 80%, then you only need to be on an inhaler called Combivent, and you only need to take it as needed. If your FEV1 is 50 to 80%, then you need to continue the COMBIVENT as needed, but you need to add tiotropium or Spiriva daily. And this is not a medication that you'll take as needed. This is a medication you take every day, no matter how you feel, because it's a controller medication. It prevents you from your COPD from getting worse. If your FEV1 is less than 50%, then you'll continue the COMBIVENT and Spiriva, and you'll add Advair, which is a twice daily inhaler. And this, again, is a controller medication, so it's not a medication that you just take when you're feeling sick, but you should take it every day, twice a day. And when we talk about being on your right medications for COPD include oxygen. So you should know what your pulse ox is, or the percent number that you are when you're on a pulse oximeter. Usually a pulse oximeter is something you put on your finger in the hospital or the doctor's office. If that number is 88% or less, then you should be on long-term oxygen at home. And if it dips below 88% or 89% when you're sleeping or when you're walking, then you should be on oxygen for sleep or oxygen when you are exerting yourself. So tip number 5, in addition to being prescribed the right meds, and part of that is on you, making sure that your doctor has given you your FEV1, that you have gotten your lung function tests, and that your doctor has prescribed the right medications. But it's up to you to take those medications. And these are pictures of the medications we've described. COMBIVENT, which is the inhaler that you'll use as needed. Spiriva, which is the first medication to be prescribed if your FEV1 is 50 to 80%. And then Advair if your FEV1 is less than 50%. Tip number 6 is to make sure you are you get the pneumonia vaccine or the pneumococcal vaccine. This will help prevent an exacerbation and a complication of a COPD, which is pneumonia. Pneumonia is one of the top 10 causes of death in the United States. Now, the pneumococcal vaccine is recommended as soon as you're diagnosed with COPD, and then again at age 65 if the last time you got the shot was over 5 years ago. If it was less than 5 years ago, then you should wait after your 65th birthday until it's 5 years after your first shot and then get a booster. Tip number 7, another very important way to prevent COPD exacerbations and complications of COPD in general, is to get the flu shot every year. Tip number 8. If you are having a COPD exacerbation, we've discussed the ways to prevent it in the first place. But let's say you get one anyway, and so you have an increase in shortness of breath or increase in cough, or your sputum is getting more, or it's getting green or yellow, it's changing color, then it's important for you to see your doctor immediately. Your doctor can look at your pulse oximeter to see if you need oxygen, can send some labs and a chest x-ray to see if you have pneumonia or a pneumothorax, which is a collapse of part of your lung. Your doctor can provide you all the right medications that you'll need to take in a COPD exacerbation, which may include steroids as well as antibiotics. And your doctor will be able to determine along with you whether it's appropriate for you to be admitted to the hospital. Tip number 9, once you are diagnosed with a COPD exacerbation, if you are sent home, it's extremely important for you to take the medications that were prescribed by your doctor. If they were antibiotics and steroids, it's important to continue the course for as many days as prescribed and not stop until the bottle is empty. Don't stop when you just feel better. Stop according to the duration of the prescription. And remember to return if your symptoms get worse or if they're not getting any better. And tip number 10 is to believe in yourself. Quitting smoking or not smoking at all is the most effective way for you to avoid getting COPD. I've discussed multiple ways for you to prevent COPD from getting worse if you already have it, and I've explained what to do if you do think you may have a COPD exacerbation. I hope these tips have been helpful. Thank you very much for listening, and have a great day.